Okay, here we go, guys. All right, so medications for use throughout and the end of pregnancy and during delivery. Okay, it's a totally specialized category of drugs. Okay, so they'll be used antepartum, intrapartum, and postpartum. Okay, some of the medications that we're going to look at, we have our tocolytics. Okay, we have, you can see here, we can see these, right here. It says these include tocolytics, oxytocics, uterine relaxants, and abortifacents. Okay, these are used primarily to slow abortion at the time of delivery or help expel the fetus from the uterus or to terminate pregnancy. See if we can get the whole thing to light up here. Okay. Alright guys, so let's look at the action of some of these medications. Abortifacents stimulate or increase uterine contractions. Okay, they're also going to cause the uterus to empty in order to produce an abortion. Okay, your oxytocic agents are going to be used during labor, and they're going to use to contract, cause the uterus to contract, trying to help move the baby along onto where it can be delivered. Okay, oxytocin is one of these types of muscles. Okay, also our abortifacents, okay, are actually going to be used to terminate pregnancy. Uterine relaxants are going to work to help stop uterine smooth muscle contractions. And then your tocolytics are used to help stop preterm labor. Okay. So actions and uses, okay, like we mentioned, abortifacents are used early in pregnancy to end pregnancy by emptying the uterus. Okay. Stimulate uterine contractions and cause the uterus to empty out. All right. So it says stimulate or induce labor at term where they are medical problems or life-threatening issues to the mother or fetus, to assist in delivery of the shoulder or infant, to assist in the release of the placenta, to control postpartum bleed or lack of muscle tone. It says to relieve breast swelling or engorgement. It says stimulate uterine contraction after a cesarean and to treat incomplete abortion. Okay. And then the ergos that were mentioned a little bit ago, it says are used to prevent or control hemorrhage after the delivery of the placenta and in the postpartum period. All right, now your uterine relaxants and tocolytics, it says are used when mother goes into preterm. See if we can highlight this here. We'll go backwards with it. There we go. All right. Preterm labor is to delay delivery. All right. All right. It says it's also been used with ritodrin therapy, along with questionable efficacy and increase in adverse reactions. All right. It helps reduce the risk of preterm delivery before 37 weeks. Right here. Okay. And also, it says the Food and Drug Administration has warned. Let's highlight this here. Okay, it says has warned the injectable or oral terbutaline, a drug long used for off-label to prevent premature birth, should not be used beyond 48 to 72 hours of preterm labor because of potential for serious maternal cardiovascular events. All right. So our adverse reactions. Abortifacents can cause cramping and pain. Okay, you can see here. Highlight that. Okay, your tocolytics. It says produce visual disturbances, oxytocin, irregular heartbeat, dysrhythmias. Okay, also redness of skin during administration, nausea, vomiting. You see all of that right there. Okay, get this back that way. There we go. All right, postpartum hemorrhage, cyanosis, dyspnea. Your ergos, nausea, vomiting, allergic reactions. Okay, bradycardia, hypotension, hypertension, cerebral spinal symptoms, spasms. Okay. It also says here the most common side effect reported for your hydroxyprogesterone caprate include pain, injection at the site, hives, diarrhea. It says serious reactions are rare. Okay. And vasoconstrictors, and you look at drug interactions, vasoconstrictors and local anesthetics increase the effects of oxytocins. All right, so nursing implications, patient teachings. All right, assessment. It says beware that the patient may want to terminate an unwanted pregnancy early in gestation. All right, a history of incomplete abortion, cesarean sections, excessive postpartum bleeding may require use of oxytocin meds or ergos. All right, so ask questions. What additional problems does the patient have? Does the mother have concerns about the health of the child? Has the mother had problems in the past or had engorged breast or breastfeeding? All right, is there a cultural belief that will impact what's going on with the delivery of the baby? Is the father or family involved in the process as well in helping make these decisions? So ask a lot of these questions and find out which is the best route to go with the patient and these medications. So implementation, it does say that in many cases in the United States, oxytocin is the drug of choice to induce labor. Okay, it says, however, prostaglandins are now preferred in some reasons, and they're usually given intravenously. Okay. Now, ergonovine is now the drug of choice to control postpartum bleeding, and it can be given sublingual, intramuscular, intravenously in emergency situations. All right, so most of these meds are going to be intravenously. And you can see that the ergo preparations are usually given intravenously as well. All right, so patient family teachings. Let's highlight this up here. Make sure you guys read over your drugs and your medications here. All right. Read table 18.4. Make sure you read over that, guys. Oops, I went the wrong way. All right, so your patient family teachings. Okay, let them know oxytocins or ergos are given to augment the body's natural action during and after labor. It says the patient will be watched continually throughout this treatment, and contractions should not be more intense than normal. Ergonovine might stimulate cramping. And if this becomes intense, the patient should inform the nurse or the physician right away. All right, let's go on to pituitary and adrenocortical hormones. All right, we know the pituitary is called the master gland, right? It secretes or signals for everything. All right, so remember our adenohypophysis, okay, is the back portion of the pituitary, the posterior pituitary. Okay, I'm sorry, the anterior pituitary. The adenohypophysis is the anterior pituitary. The neurohypophysis is the back. Because the neural, it doesn't get a signal of chemicals from the brain. It gets an electrical signal. It gets nerve impulses that tell it to do its job. Okay. So these are going to control hormone production, cell growth, electrolyte balance, water retention, and it says loss of reproductive cycle. All right. So let's look at your pituitary hormones. All right. You got your HCG, your luteinizing, your follicle stimulating. Okay. You have your sex hormones, ACTH. Okay, these are the major anterior pituitary hormones. Okay. So it says there's a adverse reactions for these medications. Okay, can be systemic, or they can actually cause localized complications. All right, so let's look at some of the interactions that we have. So if we flip over to table 18.8, I'm sorry, 18.6. Here we go. So if we look at some of your side effects here, all right, I want you guys to read over this, be familiar with these. All right, and then some of the drug interactions that can happen with these oral. Note that your oral anti-diabetic agents can cause increase effects of vasopressins. Also, it's going to have an effect on your epinephrine, heparin. Alcohol can decrease the effects of these medications. Also, your antidiuretics can affect demopressin, also lithium, epinephrine, heparin, and alcohol as well. Alright, so we're going to stop right there, and I'm going to send you this section of the video, and then we'll continue.